of course, we need to therefore target the pain and also the disability, because we shouldn't just treat the X-ray, but we should treat what the patient is having discomfort with. And some of this pain and disability is predicted by the severity. Although I mentioned earlier, sometimes the X-ray can look very bad, but the pain is not very bad. Sometimes the X-ray can look fairly normal, but the pain is tremendous. That's because the X-ray only shows the bone, but the pain can come from other soft tissue, as mentioned earlier. Then, of course, we need to also look at the depression and psychological status of patient, because when they are low mood, their pain perception will be worse. Certainly, isolation, having a low quality of life is an issue for some of these patients, because they cannot go out as much because of the disability or the mobility issues. So we need to look into those things as well. Increasingly, I think we're looking at the social determinants of health of our patients and not just the clinical problem faced by them. So therefore, we need to not only treat those pain with the relevant pain relievers, but we also should look into other issues in their life, because that actually can cause pain and disability as well. So in terms of the aims of treatment, we first have to empower the patients to be able to manage their own condition, and that's why talks like this will be helpful. Symptom relief with the appropriate analgesics will be very important. We also would like to increase the functional ability of the patient and therefore the quality of life. So exercise and other appropriate measures will be very helpful. We also try to prevent the patients from losing their work, so they will continue to have meaningful work and a source of income. And of course, where possible, we always try to slow down the disease progression. So these are the aims of the treatment. And very importantly, there are a lot of non-pharmacological measures that we can help our patients with. For example, we need to educate the patient about what is this condition and how they can prevent it from progressing. Oftentimes, the lifestyle modification in terms of proper diet and exercise to have weight reduction and to enhance the strength and stability of the joints are very important. Where possible, we continue to also advise some walking aids and corrective footwear, because sometimes the footwear being like wearing high heels or shoes that are not fitting will cause the misalignment of the joints to become worse. Conversely, if we actually make some adjustment to the footwear, we can realign the joints a bit better, and then the mechanical loading will be better distributed, and hopefully the progression will become retarded. Then, of course, we have always advised on exercise also to maintain strength and improve function and also balance. And where sometimes we can, we try to correct the biomechanics of the joint, sometimes with taping and with other appropriate prosthesis that the occupation therapists or physiotherapists can advise.